Why is healthcare so expensive in the US? You break your arm, you go to the ER, 4 hours later you leave with a bill for $7,000. No surgery, no hospital stay, just a cast, an x-ray, and a massive hole in your wallet. How did we get here? Why is healthcare in the US so expensive more than in any other developed country? It's not just one reason. It's a system with layers of costs, hidden deals, and powerful incentives. And today, we're gonna peel it all back. Let's start with this. The US spends more than any other country on healthcare by far. In 2025, the average annual healthcare spending per person in the US is over $13,000. Compare that to $6,700 in Germany or $5,300 in the UK. And no, don't have better health outcomes. Life expectancy, lower. Infant mortality, higher. Chronic disease, more common. So, what's going on? 1. No price transparency. In most countries, the price of medical services is negotiated at a national level or is clearly regulated. In the US, two patients can get the exact same procedure at the same hospital and get charged completely different amounts. Why? Because prices are negotiated in secret between hospitals and insurance companies. You rarely know what anything costs until you get the bill. And hospitals can inflate list prices knowing insurance will knock them down unless you don't have insurance, in which case you're stuck with the full amount. 2. Administrative overhead. The US healthcare system is incredibly complex. Thousands of private insurance plans, endless billing codes, dozens of intermediaries each taking a cut. It's estimated that 25 to 30% of total healthcare spending goes to administrative costs, far more than in single-payer systems like Canada or France. Doctors often need entire teams just to deal with billing. Patients waste hours navigating paperwork and denials, and every layer of complexity adds cost, confusion, and delays. 3. Drug prices. The US pays more for the same medications. A bottle of insulin in Canada, about $30. In the US, it can cost over $300 for the exact same product. Why? Because the US government doesn't negotiate drug prices directly. Pharmaceutical companies can set prices high, and the lack of regulation means little pushback. Yes, innovation matters. Yes, new drugs are expensive to develop. But the markup isn't always about science, it's about profit margins. 4. For-profit system. In the US, many hospitals, insurance companies, and even ambulance services are run for profit. This means higher costs are often justified not by care but by business models, CEO bonuses, shareholder demands, revenue targets. Healthcare becomes a market product, not a basic human service. And when profit is the priority, patients pay the price literally. 5. Defensive medicine and overtreatment. Doctors in the US are often pressured to order extra tests and procedures, not just for patient safety but to avoid lawsuits. It's called defensive medicine. And it leads to unnecessary MRIs, duplicate blood tests, or overnight stays that might not be medically required. More care isn't always better care, but it is always more expensive. So, can it change? Reform is complicated. Lobbying by the healthcare industry is strong, spending over $700 million a year to influence policy. Some progress is happening, like the Inflation Reduction Act, allowing Medicare to negotiate drug prices, or more state-level price transparency laws. But systemic change? It'll take political will and public pressure. Here's the truth. Healthcare is expensive in the US, not because it has to be, but because the system is designed that way. Profits over pace, complexity over clarity, pricing that makes no sense. If you've ever felt overwhelmed, frustrated, or helpless trying to understand your bill, you're not alone. And if you want this video to reach more people who feel the same, leave a like and drop a comment sharing your own experience with healthcare costs in the US. This video is for informational purposes only and does not constitute professional, medical, or legal advice.